All right, Jonah, patient assessment, medical. You have 15 minutes to complete this skill sheet. Do you have any questions?
I do not.
Okay, you are dispatched to a private residence for a 56-year-old male, altered mental status, possible stroke.
Okay. Be advised my seems safe.
Uh-huh.
Right. My NOI at this time is going to be a possible stroke. This is my only patient.
Mm-hmm.
Okay. I'm going to also call in additional resources if I need them, and I'm going to always consider C-spine precautions as
Okay.
well.
You arrive on scene. The patient's wife meets you at the door.
Okay.
She says that he's been acting funny all day, and she started to notice that he was slurring his words, and the words that he was using weren't making sense.
Okay. Well, my impression of my patient right now is just going to be poor. It seems like he might be slightly altered, facial droop, all of those kinds of things. So that's going to be my impression. What's his responsive level right now? How?
He is alert, tracks you as you walk into the door.
Okay. Any apparent life threats
No.
for this patient right now? No? Okay. All right. I'm going to assess his airways at patent right now.
It is.
Okay. How about his breathing? What's his rate rhythm quality for that?
He's 18 a minute and regular.
Okay.
Bilateral, just rise and fall.
Okay. What about his pulse? Is it rhythm rate quality for that?
It is 90 and regular.
Regular.
Yep.
Okay. What about my skin signs? What do I see for that?
He's pink, warm, and dry.
Pink, warm, and dry. Okay. Does it seem like he's perfusing decent enough right now?
Yes.
Okay. My transport decision right now is I'm going to just stay and play. Just for the time being, taking into consideration that I might need to rapidly transport this patient at any time.
Okay.
I'm going to go into some history taking too. When was my patient last seen normal?
Wife tells you patient was last seen normal at 9:30.
Okay.
It is now 10:37.
Okay, so about an hour ago. What was the onset to this like?
We were just having our morning coffee, and he started to act kind of funny.
Does the patient have history of stroke or TIA?
He has high blood pressure.
High blood pressure? Does he take medication for that too?
Yes, lisinopril.
Okay. Cool. I'm going to go through all my OPQRST questions. Is there anything significant for any of those?
Nothing makes it better
Nothing makes
or
it better.
worse. He's not in any pain, but you
No
notice
pain.
left side facial droop.
Okay.
Doesn't radiate anywhere. Wife is pretty upset that he's sick, and it's been going on for 1 hour.
1 hour. Okay. Does this patient have any allergies?
No drug allergies.
Okay. My signs and symptoms are facial droop right now, slurring of words. Any medications that he takes other than the lisinopril for
No.
high blood pressure? Okay. No cardiac issues?
Nope.
Any other past pertinent medical history, diabetes, breathing issues?
No, just the high blood pressure.
Okay. What was his last oral intake? Just coffee?
He had breakfast at
Breakfast
8
as
a.m.
well? Okay. Any special events leading up to this?
Nope, he was just sitting there reading the paper, drinking his coffee.
Okay. I'm also going to get a full set of vitals. I want a blood sugar just in case, blood pressure, pulse, respirations, my quality of respirations, SpO2 as well.
Okay, blood pressure is 180 over 130.
Okay.
Respiratory rate is 18 a minute, regular. Respiratory quality is good. Pulse oximeter is 98% room air.
Okay.
Anything else that you want to know?
Did you say blood sugar?
I did not. His blood sugar is 120.
120. Okay. Well, just due to my patient being able to oxygenate himself appropriately at this time, I'm not going to use any oxygen therapy, but I'll always have that into consideration.
Okay.
And did he take his lisinopril this morning?
Yes.
Okay. I'm also going to, as one of my vital signs, I'm going to perform a stroke assessment on my patient as well and check his pupils. What do those look like?
What stroke assessment are you going to use?
Cincinnati.
Okay, what are you going to look at for your Cincinnati?
I'm going to have my patient smile, looking for facial droop, speech. I'm also going to have my patient hold their hands upwards towards the ceiling with their palms facing up, see if I have any drooping on one side. Also, I'm going to test strength in each hand as well.
Okay, so you notice slurred speech, facial droop, and he has left arm weakness. Grip strength is normal.
Okay. My transport decision is I'm going to load and go. I'm going to get this patient going. I have an hour that these symptoms have been going on, so I want to get them to a hospital as quickly as possible. My treatment plans right now is I'm going to be managing my patient's airway if there's any issues with that, making them as comfortable as I can. I'm going to start a large bore IV, have my vitals going every 5 minutes, also just reassessing his symptoms and signs, seeing if they're getting any worse for my patient, making sure that my patient's in a position of comfort as well, and just rapid transport. When I reassess his vitals, is there anything different?
No.
Okay.
What do you think is going on with this patient?
I do believe that this patient is having stroke-like symptoms, so possible stroke. And
Okay.
I'm going to send out a stroke alert to the hospital.
Okay, so your closest facility is 5 minutes away.
Okay.
Not a stroke center, but they do have imaging.
Imaging, okay.
Your second closest is 35 minutes away and is a region stroke center. What facility are you going to pick?
I'm going to go to my region stroke facility.
Okay. Anything else you'd like to add?
Not at this time, no.
Jess, you want to hit pause on that?